Hi, I'm Dr. Sally Shott.
And I'm Dr. Chrissy Heubi. We are both pediatric ear, nose, and throat doctors at Cincinnati Children's Hospital. Dr. Shott, I know you've been in practice for many years, and I'm newer to the practice, but I worked as your research assistant on children with Down syndrome many years ago. And this is a topic very near and dear to your heart. So when you see a child with Down syndrome in your clinic, what are the most common ENT issues you see?
Well, one of the first issues that comes up, and the earliest issues, is very small ear canals. About 50% of babies born with Down syndrome will have very tiny ear canals, making examination and diagnosis of any ear problems very difficult. This can take several years before it gets better. Now, if your pediatrician is unable to see your child's eardrums, they may refer you to an ear, nose, and throat doctor. Now, there's a couple of reasons for that. We have fancy microscopes in our office and specially made really tiny ear instruments, so we can thoroughly clean your child's ear canal and get a good look of the eardrum. This is particularly important because there's also a higher incidence of chronic ear infections or even fluid that just won't go away in children with Down syndrome. And this can affect hearing. If you can't see the eardrum, you can't make a diagnosis and you can't treat it.
Yeah, I find that if I struggle to see the eardrums, I need to see you more often. Or I need to sort of send a note to the pediatrician recommending that we see you more frequently. Because as we know, children with Down syndrome also have a higher rate of hearing loss. We have found that this is often due to this persistent fluid or recurrent infections. If the middle ear fluid doesn't go away within 3 months, or if you have repeated infections, say 3 and 6 months, we would recommend pressure equalization tubes or ear tubes. Another issue that comes up in clinic very often is sleep. How is your child sleeping?
So we ask, is it nice and quiet and gentle, peaceful sleep, or are they moving all over the bed? Are they making noises when they sleep? And it could be anything from strange noises to snoring. Children with Down syndrome, unfortunately, do have a higher incidence of obstructive sleep apnea compared to other children.
And we found that studies show that parental report of the degree of obstruction or the signs of obstruction are not reliable in children with Down syndrome. The American Academy of Pediatrics has published guidelines that all children with Down syndrome should have a sleep study done in a lab where we get objective data about how your child is sleeping by 4 years of age.
But what if, on the other hand, you have a 5-year-old who's never had a sleep study, or even a 15-year-old? That's okay. Get it done now.
We recommend that if you haven't had one, to go ahead and schedule that or see a sleep provider to discuss getting a sleep study performed. We also recommend that you do watch for those symptoms and signs: snoring, gasping or choking with sleep, snorting, or stopping breathing.
Or sleeping in very strange positions, such as sleeping sitting up, or sleeping bent forward at the waist, or sleeping with their head hyperextended. All of these symptoms are suggestive of sleep disordered breathing, and you need to tell your primary care doctor about this, and you may get referred to a sleep specialist or an ENT doctor for further evaluation.
And I don't know about you, Dr. Shott, but I get a lot of patients where the parents say that the nose will not stop running. It's just this constantly running nose.
And you're right. Unfortunately, particularly in the young children, there tends to be a lot of nasal congestion and runny nose or rhinitis in children with Down syndrome. A lot of this is due to the mid portion of the face being smaller than in other children. And what happens is the sinuses and the nose more easily gets blocked and it can't drain properly.
And we also know that the immune system tends to mature slower. And so what that means is you frequently have more respiratory illnesses, colds that tend to last longer than is typical.
But the good thing is, as the immune system develops, this gets better as the years go on. In addition, we have found medical treatment with saltwater nasal sprays or some of the over-the-counter antihistamines can be very helpful, particularly the medications that don't make you sleepy, and there's now ones you only have to give once a day.
And for many patients, the daily nasal steroid sprays have actually made a huge difference, a real game changer for many of our patients.
Another issue that parents will frequently bring up is feeding issues.
So if your child is choking with feeding, if they are having coughing with feeding, or if they're having difficulty with weight gain, it's something we would want to evaluate, and it may concern us for a further evaluation.
Another thing is just recurrent lung infections. If we see these types of symptoms, one of the things we worry about is that when your child is eating, food is going down the wrong tube. So usually you take a drink of water, eat something, it's going to go down your feeding tube or esophagus. But occasionally it could also be going down the windpipe or trachea. This is called aspiration. We sometimes will suggest getting a study called a video swallowing study to further evaluate for this.
Right. So these are a lot of the things we cover in our initial visits and in follow-up visits, and we've covered quite a bit of information here. For more details, the American Academy of Pediatrics has published guidelines for healthcare and monitoring of children with Down syndrome. Here's the link if you would like to get a copy.
We are happy to answer any of your questions or help refer you to a local ear, nose, and throat doctor. Please contact us at these email addresses.